Gentleman yields back. The chair recognizes the gentleman from Texas, Mr. Crenshaw, for 5 minutes.
Thank you, Mr. Chairman. Thank you for all our witnesses for being here. And on this important topic, I think the way we pay for healthcare is the most frustrating thing about healthcare in America, and the way we finance it. And it's clear as day that it is the primary driver of our debt, despite all the hand-wringing and yelling and screaming about our annual appropriations process that we do up here. That appropriations process is completely dwarfed by our healthcare spending. New data shows that between Medicare, Medicaid, and Affordable Care Act spending, it actually is larger, just those three, larger than all of our discretionary spending. And I did not say Social Security. Social Security is not even included in that bucket. So that's really something. Medicare, Medicaid, ACA, all bigger than our entire appropriations bill that will eventually pass. Healthcare is a difficult issue because we want market forces to be available within it to create competition, which is what drives prices lower, and to increase quality. But we also want it to be available and accessible to all Americans. So it makes it a difficult problem. But I want to focus on how it is the biggest driver of our spending. 2/3 of our spending it's on autopilot, it's automatic. So, Dr. White, last year the Congressional Budget Office estimated the federal deficit would grow over the next 10 years by $4 trillion. But then 9 months later, that estimate changed to $20 trillion. That's a pretty big difference. Can you explain to me the role that mandatory government programs have in driving that deficit increase? $4 trillion to $20 trillion is a pretty big deal.
That's a complicated question. So I'll just say that there are a lot of moving parts in the update to our projections of the deficit. And I know my boss, Dr. Swagel, has been testifying to the House Budget Oversight Committee on updates to our deficit estimates for FY23 and going forward. In the healthcare space, we've actually been doing a pretty good job of projecting where those federal subsidies are going, and the federal subsidies for healthcare actually aren't a big player in the update of our deficit estimate for 2023. We did underestimate the take-up of the expanded enhanced subsidies for the ACA marketplace plans. We underestimated that. We've boosted our take-up projections of those plans, but it's not a huge driver of the updates to our deficit projections.
So can we, as these subsidies are set to expire, can we expect insurance subsidies to grow the deficit more if they're extended without reform, or you're saying they're not a big driver?
If the enhanced subsidies were extended past 2025, that would increase federal costs.
Do you have an estimate on how much?
I don't have one at my fingertips. I'd be happy to respond in writing.
Okay. Dr. Ippolito, during our last hearing, you had mentioned that direct primary care might be a more cost-efficient overall type of practice, since it's a form of capitation. What role do personalized care models like direct primary care play in creating a marketplace that lowers costs?
Yeah, so I stand by that assessment. In general, health insurance is good at protecting people against uncertain high-cost events. Things that are routine, relatively low cost, are relatively bad candidates for inclusion in health insurance. So to the extent that there are innovative models that try and take it out of that relatively high administrative cost setting, I think that's worth exploring.
Well, I appreciate it. And Ms. Martin, you focus on patient behavior. What does a continuity of care approach, especially through options like direct primary care, do for addressing overall healthcare spending?
The impact of direct primary care spending on continuity of care is beyond the scope of what we would ordinarily look at, so I would like to think about that some more and get back to you.
Okay. One comment in my last few seconds is on the small business insurance costs. You know, in 2021, small business employee premiums increased by at least 12% relative to the previous year. Based on the Agency for Healthcare Research and Quality data, we saw employee contributions rise by 24% in the last 10 years for small employers. And I think it's clear small businesses are bearing the brunt of insurance costs. And, you know, Dr., well, I'm out of time, so I won't ask the question, but I think it's important to level the playing field, allow small businesses to provide affordable coverage to their employees and congregate and associate as such. Thank you. I yield back.